Hello, my name is Dr. Jenny Johnson, and I have a PhD in nursing from Loyola University in Chicago. If you're viewing this video today, it means that probably a doctor, a nurse practitioner, or a physician's assistant, or some medical person has recognized that you need to make some changes in your behaviors. Eliminate some bad behaviors and replace them with good behaviors because they're concerned about your risk for a heart attack or stroke. If you're like most people, you've probably tried many times to make those changes, but you keep running up against a brick wall. You might stick with it for a couple of days or even a couple of weeks, and then all of a sudden the bad habits return. You hit that wall, the barriers are overwhelming, and you give up and you quit. What I'm going to talk about in the next 10 to 15 minutes or so on this video is a little bit about why you're struggling with that. What are the issues that keep you from meeting the goals that you want to meet? And also, what we've learned from the world of psychology that helps increase that motivation for you to stick with it. And then finally, I'll talk about my services and how I help people, whether it be one-on-one coaching or through presentations to groups and that sort of thing. I am writing a book right now, and I'll talk a little bit about that at the end of it as well. Okay, so what's going on? Well, doctors and nurses mean well. They want you to be healthier. They want you to, reduce your risk factors and change your behaviors. But really, they don't have time to talk to you about your barriers. They're busy enough just trying to diagnose what's going on and treat it. They don't have time to really sit down and talk with you about your struggles and why you're having a hard time doing the very thing that they're asking you to do. So that's one of the problems. The second problem, medical schools and nursing schools aren't really trained or educated in how to help people work through these difficult and challenging behaviors. It is true, it's much easier said than done when we speak about behavior change. I like to think that I help kind of bring the bridge between what the medical world can provide and what the psychology world provides. As a nurse, I cared for many people who suffered from a heart attack and stroke the first half of my career. The second half of my career, I was focused on preventing heart attacks and stroke. And I worked with patients on living that healthier lifestyle, making those healthier choices. And when I went back to get my PhD in nursing, I wanted to study, well, what works? For those people who are able to make those changes, what do they do that's different from those people who are not able to make those changes? So I'm going to share a little bit of that information with you today. And I have to draw on the world of psychology because I think Dr. James Prochaska has done a lot to really help us understand the challenges that people go through when they're trying to change behaviors. It's really tough to do, as you know. And he came up with a theory that's really pretty ingenious. And you can buy his book, Changing for Good, or rent it or whatever, and read it. There's many more components to it than what I'm going to talk about today. And I'm not going to use his terminology for his stages of change. I'm going to create some of my own so that it's easier for you to understand. And I found that I have a friend that has a PhD in engineering. He's a really sharp guy. And I have a truck driver friend who's also very sharp. But when it comes to healthcare, they both have very similar questions. And I think we make assumptions about people. They're just not true. We need to bring it way down and start at the very bottom and basic and kind of build on what the patient knows and use everyday language, not complex medical jargon. So I'm going to try to do that as well. So the first stage of change, Dr. Prochaska called pre-contemplation. I'm going to call it denial. And it can take one of two forms. It could be the person who literally is not aware that the harmful behavior that they enjoy is causing these negative health outcomes that the doctor and nurses are seeing in their practice. So we need to do a better job of connecting those dots, of helping people understand how their behaviors are impacting their health. And I think we can do a lot to improve on that. And I think I do that when I work with patients. And that's I'm able to add that medical piece with the psychology piece that helps you become more successful. The other part of denial is the person who gets it. I know that this is causing a poor health outcome that's bad for my health. I just don't want to change. Leave me alone. Don't talk about it. Go away, healthcare provider. And we often see that with smoking patients. And if you've never smoked, You can't even begin to imagine how difficult it is for these people to quit. Statistics from the national guidelines tell us their research has shown that 70% of people want to quit smoking. But I have yet to meet a smoker that I don't teach a couple things to, because they're just not aware of all the resources that are out there to help them be successful with this difficult habit. And I can help them with that. So if you've never smoked, imagine that every time you take a puff on a cigarette, you get a shot of dopamine to the brain, which is like liquid Valium. Who wouldn't want to smoke getting that kind of effect? And then when you withdraw the nicotine, they go through some pretty uncomfortable withdrawal symptoms for a few days. And it's those two things that make it really challenging for them to quit. So often you'll see them very resistant. They're actually my favorite patients to work with because I like to break through that denial and challenge their thinking and that sort of thing. But that's very common with the denial, the first stage of behavior change. You either don't know about it or you know about it, you're not interested in changing yet. The second stage is called pros and cons. Prochaska called it the contemplation stage. It's where you're weighing the benefits versus the cost of making this behavior change. And I have found in my work with people and my research, people can languish or get stuck in this stage for decades, years and years and years. Well, I know I need to make this behavior change, but oh my gosh, the cost is just too great. The barriers are too strong. And sometimes it's evidence of wear and tear on their own body that starts to make them consider the change. And there's some screening tools that can pick up undiagnosed plaque building up in the arteries before a person's had a heart attack or stroke. And that can be a huge wake-up call for people. It could be abnormal cholesterol numbers or abnormal blood pressure, which starts to happen as we get older. It's like little time bombs ticking, and at some point in our age, based on our genetic makeup, it goes off, and we all of a sudden have these goofy numbers. Or it could be a heart attack or stroke in a loved one or a friend or even a famous person that is enough to motivate this person out of that pros and cons stage into taking action. The third stage is called preparation, Prochaska's language, my language, baby steps. The person is taking baby steps at trying out this new change. Not convinced that they're going to be able to do it, but they're trying it on for size to see if it fits. The fourth stage, Prochaska called action. I call it changing. You are changing. Your motivation is great. You are quit smoking. You're in a smoking cessation group maybe, or you are losing weight. You're eating better. You're exercising. I mean, you are really going at this thing. You are motivated to make it work. And the fifth stage, Prochaska called maintenance. I call it success. You've been at it for 6 months. Your brain has learned this new behavior. It's part of your life. You're doing it. Now, why is it important to know about all these different stages? Well, Prochaska also found that only about 20% of people at any given time are really motivated enough to take serious action to change their behavior. Most everybody else is in what I call a non-action change. They're either in denial, they're either contemplating the pros and cons, they're either taking baby steps, but they are not motivated to take action to change their behavior. And that's important because if you give action-oriented information, which is what most healthcare people do, I found that in my research, that almost all the advice is very action-oriented, it's going to overwhelm everybody else. They're just not ready to hear it. You'll sit in the doctor's office while your doctor's giving you that information, and you'll nod your head and you'll agree. Again, I'll give it another try. But you'll go home and you'll fail because you're not ready for that type of approach. So I fine-tune it. I figure out where you're at, and then I work with you. And it's not my prescription that counts. It's what you are willing to change. Because quality of life is important, and every person has to make that decision. What am I willing to change? Because we know that the more you're able to live that healthier lifestyle, the less medications your doctor will need to prescribe to counteract some of those genetic abnormalities that you may have been born with. But it's a choice that every person has to make. And when we talk about prescribing changes, they need to be small, doable, things that you'll be successful, because success begets more success. And I love the quote from Brian Wansink, who is a nutrition researcher, psychologist, and he said, the best diet is the one that you don't know that you're on. And that's my philosophy with all these changes. They need to be subtle. They need to be small. They need to fit into your everyday life. If they're too hard, too fast, you're just setting yourself up for not being able to carry them out. So they have to be doable. And I find that people make a lot of really silly mistakes because they just don't know better, and you correct that, and it makes a big difference in their health. So those are the things that I teach. I'm going to show you some information here on my website, which is www.living4ahealthyheart.com. And I'm on that website. You'll find more information about me, my credentials, my background, what I provide, and just additional information. If you want to contact me through email, jjohnson@living4ahealthyheart.com. So both of those ways you can get in touch with me, and I can talk to you about the kinds of things that I do. I am writing a book right now, and I hope to have that on the website soon. And in that book, I'm kind of throwing in my experience over the years with understanding what patients need to know as they're making these decisions about behavior change. And I have a couple chapters where I talk about how that harmful behavior impacts your risk for heart attack and stroke. So what's going on there? In simple language that I think that you'll find very, very helpful in connecting the dots. I also talk about the major risk factors. I have a whole chapter on cholesterol, and I really explain the numbers, so it takes the confusion out of it, because most people get very confused about the numbers language when doctors are talking about your cholesterol numbers. And I have a chapter on blood pressure, how to measure your blood pressure to tell if you really do have a problem with high blood pressure. And all those major risk factors, I have chapters on that in my book in simple everyday language. I also have the major components of behavior change that people need to work on, like healthy eating, increasing your activity, and no one should ever start an exercise program if they're middle-aged or they have risk factors for heart disease without checking with your doctor and getting medical clearance. But even simple things like going for a 10-minute walk can make big differences in your health. It's just people think if I'm not in the gym working out 30 minutes every day of every week, I'm not having any benefits to health, and that's not true. So I talk about that. So that's the book, and hopefully that'll be coming, and the information will be on the website. I'm also a public speaker. If you're the owner of a company and you're concerned about rising healthcare costs, as everyone is, and you want to give your employees a wake-up call to take better care of their hearts and their bodies and that sort of thing, I'm happy to come out and give them a lecture, and you can find information on how to schedule that as well. So that's pretty much my contact information. I want to close with a couple of stories on how I work with patients. And one example, I'll use me as the example. So when I was working with patients, coaching them through their health behaviors and giving them results of a screening test that we were running, our office for the patients was on the first floor. But our office, our cubby holes, were on the second floor. So that meant I left the office, I went right out of our doors, and there was the elevator right in front of me. Can't miss it, easy to do, get on the elevator, go down to the first floor. Well, I'm a nurse, I wanted to practice what I preach, now that's a concept. And so I said, well, you know what, I'm going to walk down the hall, which was a ways away, that's activity 2, and take the stairs. And so several times throughout the day, I was going up and down that one flight of stairs. That counts, that's exercise. At first, the first few weeks, I had to really think about it. I had to be mindful about it as I was making that change. But after a period of time, my brain learned that behavior, and it just became unconscious for me. I automatically went to the stairs. I never even thought about taking the elevator. And that's the kind of changes I want to make in your life. As we talk about it, what things can you do that can become part of your life is my approach. And the last story I'll talk about is a girl named Jessica that I met just a few months ago. My mom is in Atlanta, and my sister is a nurse who kind of keeps an eye out for mom, and we had her in an independent living situation, but she's progressed now to where she needs an assisted living environment. And before we moved her, I flew out there to help find an assisted living place for her, and we did, and she's very happy. But we hired some caregivers, like nurses' aides, to come into my mom's apartment and just make sure that she was taking the pills that my sister had set up for her in her little pill container, and that mom had help with her showers and that sort of thing. So I met one of the nurses' aides that morning the next morning after I flew in. Her name's Jessica, and she told me I could tell her story. And Jessica asked me, well, what do I do for a living? And I said, well, I help kind of coach people through lifestyle changes like losing weight, quitting smoking, eating better to lower their cholesterol and blood pressure, that kind of thing. Oh my gosh, she said, could you help me? And I said, I'd be happy to. So the first question I asked Jessica, which I ask anybody that I'm working with, what is the number one mistake that people make who struggle with weight? And so I want you to think about that for a minute now. What do you think the number one mistake people make who struggle with weight? It's actually skipping breakfast. It's skipping meals of any kind, but especially breakfast is problematic. And breakfast means breaking the fast. So it's an important component to a healthy lifestyle. When you've been fasting all night because you've been asleep, your body has kind of been in shutdown mode. It's holding on to the fat. I mean, it's really in a shutdown mode. And it's waiting for you to send it fuel to kind of flip up the switch and kick on the metabolism. If you don't do that, the brain starts to conserve fuel. So it holds onto your fat for dear life. So the very thing you're trying to do with weight loss, start burning some of that fat, you're not doing. And it's going to get fuel somewhere, so it gets it from the muscle. It starts to burn muscle. And what happens is that you get this, not really a nausea effect, although some people feel that. It's more like a loss of appetite. And that feels good to somebody losing weight. My gosh, I can go till 2 o'clock without even feeling hungry. But what happens at 2 o'clock? Your brain won't let you remain in this starvation mode. And it starts screaming, literally screaming for food. And that's when people binge eat. You can't shovel it in fast enough to bring your blood sugars back up. So if you eat breakfast, let's say you eat cereal at 8 a.m., and I don't recommend eating just plain cereal. I like you to have a little protein source in that as well. Because if you eat just plain cereal, you're really going to be hungry by 10 o'clock. So if you eat a little protein, it's not going to be as bad, and you may be able to go a little bit longer. But when you feel that hunger, it's frightening to people trying to lose weight. And then they think, well, I would have been better off if I didn't eat at all than have this feeling hungry 2 hours after I ate breakfast. What good is that? Well, really what's happened, if you think about it from a physiological point of view, the way God made our bodies is that you have sent fuel to your body. It's stimulated metabolism. It's flipped a switch, kicked your metabolism up a notch, and you're making energy to deal with the day. And what your brain is saying, I loved what you sent me at 8. It's now 10, send me some more healthy food. And that's when you have 1/4 of a cup of trail mix, which is a good choice, or some kind of little snack to give your body the fuel it's asking for. And I'm all about stabilizing blood sugars so that throughout the day you're eating regular meals with healthy snacks in between, and you're watching your portions, of course. And then the brain will start to trust you to send it food on a regular basis, and it'll start releasing that fat. And you'll start losing weight. So those are some simple strategies that people deal with with weight. And it sounds pretty simple, but it makes a big difference in this whole problem. So I think I've covered just about everything that I wanted to talk about today. And I'll leave you with a closing thought. So you have my email address and you've got my website that you can visit. And whether you've already had a heart attack or stroke, or whether you're trying to prevent one, you'll prevent yourself from having a second one by living that healthier life. And you'll certainly prevent one from happening initially by living that healthier life. And the more you can do with that, the less medicine your doctor is going to need to correct some of your abnormalities. And the healthy life that I talk about are simple strategies. So I will leave you with this closing thought. And this came from Benjamin Franklin. Prevention is worth a pound of cure. So just remember that. All the things you're doing now makes a big difference. And these strategies that I talk about not only prevent your risk for heart attack and stroke, but they also prevent cancer as well, because your body needs these healthy foods for a reason. So I hope I hear from you. Thank you for listening. God bless and have a great day. Take care. Bye-bye.